Since the coronavirus outbreak, U.S. President Donald Trump has maintained a sense of optimism. That's a marked contrast to other world leaders who have urged people to not underestimate the virus and to err to the side of caution. When Dr. Nancy Messonnier from CDC told reporters that a coronavirus spread is not a question of if, but when, Trump presumptuously suggested that the U.S. is winning the battle against the virus and insinuated more than once that the virus could suddenly disappear.
It's going to disappear. One day it's like a miracle, it will disappear.
That was on February 28th when there were over 4,500 cases confirmed with the 67 deaths outside China. On March 9th, when 546 cases of coronavirus and 22 deaths were confirmed in the United States, the president tweeted there were far fewer cases of COVID-19 compared to the common flu and asked people to think about that. Since then, Americans have had much to think about regarding the U.S. response to the outbreak. When the first case of coronavirus was confirmed in Seattle, Washington in late January, Dr. Helen Chu, a respiratory disease expert, and her team sought support from state and federal officials to conduct COVID-19 tests, but were turned down. Eventually, they took things into their own hands and started performing tests without government approval. Chu was heading a flu research project at that time, according to the New York Times, and was collecting nasal swabs from residents exhibiting flu symptoms. The failure to tap into the study has then said to be one of many missed chances by the federal government to ensure widespread testing during early days of the outbreak. Instead, officials across the country were left to work in the dark as the crisis grew exponentially undetected. On March 12th, Trump again promoted the idea that the virus will go away and compared to the United States death toll to other countries, saying, "We have 32 deaths at the point. When you look at this kind of numbers that you're seeing coming out of other countries, it's pretty amazing when you think of it." Stumbles over testing have been a focus for lawmakers on Capitol Hill as well as state and local officials. In a testimony to Congress on why the U.S. hasn't been able to conduct COVID-19 tests, Dr. Anthony Fauci said,
"The system is not really geared to what we need right now, what you are asking for. That is a failing. The idea of anybody getting it easily, the way people in other countries are doing it, we're not set up for that."
Other CDC officials also echoed his comments and expressed frustrations at the United States' inability to match the response of other countries like South Korea, which is testing some 10,000 people a day. So far, there has been a confirmed case in the U.S. Congress, forcing 7 other senators to go under quarantine, and among which 2 had a direct contact with President Trump. Most recently, the Brazilian president's press secretary also tested positive for coronavirus after he was seen posing with President Trump and Vice President Mike Pence over the weekend. With most governments, including France and Switzerland, suspending parliament and canceling top meetings, Trump has insisted it is very safe to hold campaign rallies, which often involved the gathering of thousands of people. Trump's delayed response has raised suspicions he was trying to keep official numbers low for a better shot at his re-election. Speaking to NPR, political reporter Dan Diamond, who investigates healthcare policy and politics, suspects Trump did not roll out aggressive testing because it may reveal more cases. For the president, the lower the number of infections, the higher the chances are for his successful re-election this fall, Diamond added. As of March 13th, Trump finally declared the coronavirus pandemic a national emergency in order to free up more funds and resources, but he still denied responsibility for delays in making virus testing kits available. While this is a good move, it may be too little too late to contain the virus that has roiled markets and disrupted the lives of everyday Americans. It's been more than 2 months, and the outbreak does not seem to be slowing. The ancient Roman philosopher Seneca once said, "We're waves of the same sea, leaves of the same tree, flowers of the same garden." It's fingers crossed for now.